My name's Eva and I'm the Early Childhood Clinical Excellence Lead at KEO Care. My background is physiotherapy, and in the last 10 years or so I've worked more holistically supporting children and families with their development. And in my role at the moment I work with new therapists working in the early childhood space at KEO to support them in supporting children and families. So when children engage in therapy, it's a common perception that it's what actually happens in the therapy session that's the important part in children learning new skills and achieving their goals. But in reality, it's what happens in between sessions that the learning happens, those everyday moments with their parent, and that's why you as the parent are the most important part in children achieving their goals. Child and family-centred practice recognises the strengths, abilities and needs of the child, as well as the knowledge, skills and resources of the family. Meaningful progress happens when the child, the family and the practitioner work together as a team. The first part of child and family-centred therapy is getting to know the child and family and working with them to set meaningful goals. The goals form the focus of therapy sessions, and so working together to create those goals that are really meaningful for the child and family means that therapy sessions will lead to meaningful outcomes. So for example, a child might have the goal of wanting to ride to the park with their siblings. They might want to be able to pick flowers as a present for their mum. A family might have a goal around making routines in their life easier, so less stress, for example, with morning routine or getting dressed. A parent might want to make shopping trips easier for them and their child. So when we think about a child's typical week, a child might have 8 hours awake in a day, which would be around 56 hours in their week. When we think about a therapy session, even if a child was able to have 1 hour of therapy every week, that's still a really small amount of time in the rest of their week. And when we think about what that therapy session looks like, if that 1 hour is just the therapist working one-on-one with their child, that's unlikely to have much carryover into the rest of the activities in their week. When the therapist is working together with the parent and the child in that session and helping the parent identify times in the routine where they can be working on strategies, that's when there's carryover going to happen into the rest of their week. Children learn best in everyday environments and relationships, and so a 1 hour therapy session that is just working one-on-one with your child is unlikely to have ongoing impact into the rest of their week and ongoing. But when that therapy session involves you working together with your child, exploring different strategies and thinking about how they can be incorporated into regular activities in your week, such as shopping or dressing, toileting, meal times or snack times, or playing with peers or siblings, that's when your child can be practicing those skills in those regular routines, which has been shown to have more impact than a program that's implemented by an early childhood professional. So as the parent, we know that you're the expert in your child. You know the motivators, your child's preferences and the history, so what's worked well in the past and what hasn't worked so well. So working together with you in the therapy sessions, we can help you identify what strategies will work best for you and your family. So we might know some strategies that have worked well for other families, but they might not necessarily work well for your child and your family. So for example, one family might find that working on communication on the drive to school works really well, whereas another family might find the drive to school really stressful, and that wouldn't be a good time to implement those strategies. So a more calm time of day, so maybe when reading a book with the child in the evening might work better for that child and family. So working with parents to increase confidence around implementing strategies into routines, but also being able to advocate for their child leads to less time needed in therapy appointments and more time for children to play, learn and be kids. Therapy isn't just what happens in the session, it's what happens between the sessions that creates change, and that's why you as a parent or caregiver are the key to your child's success.